Hi, Dr. Barker here at Peak Plastic Surgery Center. So a common question that I received during a lot of consultations and even people just calling in is how much scarring should I expect with a VASER liposuction surgery and or procedure? This is a great question because scarring with any surgery, any procedure is of paramount importance. VASER liposuction is very, very unique in terms of the liposuction world in how it treats the tissues underneath the skin, but also how many little scars are you going to receive on the external aspect of your body or your skin. So when we're talking about liposuction surgery, whether it's VASER, traditional lipo, or anything in between, all liposuction procedures involve taking fat out of the subcutaneous tissue area between your skin and your musculature fascial layer in any aspect of the body areas you're treating, whether that's arms, legs, your abdomen, your flanks, your sides, your chin. All of these places are able to be treated with liposuction, and specifically with VASER liposuction. How much scarring should you expect with this surgery? Well, when we're talking about scarring, we're not just talking about the skin scarring that you will see. These scars with liposuction procedures and with VASER lipo, that like I do in my clinic, these are called added sites. These are small, very punctate little incisions that you use in order to insert a cannula in the subcutaneous space. These are typically about 5 millimeters in total. So they're very small and they're very inconspicuous. These are the external scarring. But more importantly, the scarring that should be talked about the most is the scarring that happens in the subcutaneous plane. Anytime you're undergoing a liposuction procedure, you are going to be taking fat out of that subcutaneous plane with a hollowed out cannula. This is going to create space within that subcutaneous plane that is going to need to be scarred down and healed. This is the internal scar. With VASER liposuction, that internal scarring is much more controlled and much less bulk and much less dispersion of that scar, meaning you are not going to get as many contour irregularities that are seen superficially. And what I mean by that is when you look at VASER liposuction, you have to know the difference between it and traditional or any other modality of liposuction. What VASER liposuction does is two different modalities of treatment within the same procedure. I'm able to prep the plane of where we're going to be removing this fat so that when that fat is removed, it's not just torn out and removed from the surrounding architecture in a very traumatic manner. What it does is it melts the fat, it keeps the architecture in place, it tightens the skin over the top of it prior to when I do the liposuction. The second procedure within the whole of the VASER liposuction is the actual liposuction procedure, which I use power-assisted lipo. And what that is going to be doing is taking out that melted fat that I've already treated. So again, a good way to think about this is grapes on a vine. If you hold up a vine of grapes and just tear those grapes off the vine without gently vibrating them off or melting those grapes off, you are going to get a significant amount of trauma as compared to when you're doing it with VASER. This leads to more scarring irregularities, and more superficial contour irregularities that sometimes look like a cobblestone appearance. With VASER liposuction, because we've treated it, because when I'm going in with that power-assisted liposuction cannula, I'm taking out the fat that has already been disconnected from the surrounding architecture. It's like taking a straw and taking that melted grape juice out of a bowl rather than ripping the grapes off the vine. So again, the trauma is significantly less. The scarring is more controlled. It is not as bulky. And the superficial results are extremely more contoured and more reproducible, so I don't have to worry about those irregularities and that cobblestone appearance. When we're looking at revision necessities after a liposuction or VASER liposuction procedure, this is when the external results don't match what you were hoping to achieve in the preoperative state. Revisions are much, much more common with traditional liposuction. When we look at studies throughout the country, it's up to even 30 to 35%, which is around 1 in 3 people. Here at my clinic at Peak Plastic Surgery in Denver, Colorado, my revision rate is less than 2%, but it's again because I use the correct modality, I do it awake in my OR, so I'm able to see you move. I'm able to stand you up at the end, see what it looks like with gravity. And I know that that subcutaneous scar plate is going to be nice and dispersed, not bulk, not sitting in irregularity aspects, so that the superficial skin shows those irregularities or cobblestone appearance. So again, how much scarring should you expect from VASER liposuction procedures? Significantly less than that subcutaneous plane in terms of bulk, in terms of irregularity, which always directly correlates with what your chances are going to be to need a revision following these surgeries. Happy to answer any questions you have. Please reach out. We're always here for you.